Have you ever noticed your feet, hands, or face feeling puffy and swollen? This could be a sign of edema, a condition where fluid builds up in the body's tissues. Edema is actually quite common. Now let's talk about more of what is edema.
The word edema comes from a Greek word oedema meaning swelling. Medically, it refers to any swelling or puffiness in the body that is caused by fluid retention.
The swollen site may be red, painful, inflamed, and warm or hot to the touch.
Structure. This image illustrates the structure of a capillary bed and the consequences of the loss or disruption of local lymphatics. Here's an explanation of each labeled structure. 1. Arteriole. Small branch of an artery that leads into the capillaries. It carries oxygenated blood from the arteries into the capillary network. 2. Capillary, tiny blood vessels where the exchange of oxygen, nutrients, and waste products occurs between the blood and tissue cells. Capillaries connect arterioles to venules. Third venule is a small vein that collects deoxygenated blood from capillaries and transports it back toward larger veins. 4. Tissue cells. These are the cells of the tissues surrounding the capillaries. The cells receive nutrients and oxygen from the blood in the capillaries and release waste products back into the blood. 5. Buildup of tissue fluid causing swelling, lymphedema. Lymphedema is the accumulation of lymph fluid in the tissues, causing swelling. This condition occurs when the lymphatic system is disrupted or blocked, preventing the normal drainage of tissue fluid. The diagram shows how a disruption in the local lymphatics leads to the accumulation of fluid in the tissue space, which can result in swelling, commonly referred to as lymphedema. Mechanism. To understand more about edema, let's talk about the four main factors that determine how fluid moves between capillaries and interstitium. Edema can be divided into four types of mechanism: capillary hydrostatic pressure, plasma oncotic pressure, capillary permeability, and lymphatic obstruction. Capillary hydrostatic pressure refers to the pressure felt by the fluid in a confined space. The plasma oncotic pressure is exerted by the cells and proteins that cannot cross the capillary membrane. They attract fluid. Capillary permeability, or leakiness, affects how easily fluid gets through. Lastly, the lymphatic obstruction is a blockage of the lymph vessels that drain fluid from tissues throughout the body and allow immune cells to travel where they are needed. Causes of edema. What do you think causes edema? So, when the parts of your body swell up because there's too much fluid trapped in the tissues. It often affects the legs and feet but can occur anywhere. This swelling happens when small blood vessels leak fluid into the surrounding tissues, causing them to puff up. Pregnancy, injuries or infections, congestive heart failure, twisted ankle, burns or life-threatening infections, bee sting, blood clots or tumors, low levels of albumin and allergic reactions are all the causes of edema. Diagnosis and treatment. To understand the cause of your edema, a healthcare provider will do a physical exam and ask about your medical history. The skin over the swollen area may be stretched and shiny. If this happens, your doctor might want to do some additional tests. For medications, many medicines can cause edema, including NSAIDs, such as ibuprofen and naproxen, calcium channel blockers, corticosteroids, like prednisone and methylprednisolone, pioglitazone and rosiglitazone, pramipexole symptom. What are the symptoms of edema? The most obvious symptom of edema is swelling in the affected area. This swelling can manifest in several ways. First, the increased size. The affected body part is noticeably larger than usual. Second, skin changes. The skin over the swollen area may appear stretched, shiny, and tight. Third, pitting. When pressure is applied to the swollen area, a dimple or pit may remain after the pressure is released. This is known as pitting edema. Fourth, of course, it brings discomfort. The affected area may feel heavy, sore, or painful. And lastly, functional limitations, like swelling in the legs or feet, can make walking difficult. Intervention. some self-care techniques that can help prevent or reduce edema, including avoiding tobacco and alcohol. Second, compression. The doctor may recommend the patient wear compression, support stockings, sleeves, or gloves, usually after the swelling has gone down, to prevent further swelling. Third, healthy eating. Avoid packaged and processed foods with a high salt content. Fourth, elevation. Elevating the swollen body part above the level of the heart several times a day helps improve circulation. In some cases, elevating the affected body part while you sleep may be helpful. Fifth, maintain a healthy weight as possible, if appropriate. And lastly, movement exercise. Moving and using the muscles in the affected body part, especially the legs, may help pump the excess fluid back toward the heart. Avoid sitting or standing still for extended periods. Get up and walk when traveling, especially during air travel. Is edema preventable? The prevention of edema may not be possible depending on the cause. If edema is the result of health problems, such as congestive heart failure, liver disease, or kidney disease, the swelling can only be managed. To help prevent edema, your doctor may recommend staying as physically active as possible and avoiding excess sodium in your diet. In addition, elevate the legs when seated or lying down. Wear support stockings if you have edema of the legs. Keep moving as much as possible. Avoid sitting or standing for long periods without moving around. Limit the amount of salt in your diet. Disadvantages. One part of disadvantages is physical discomfort and limitations. It can cause pain, stiffness, difficulty in walking, and skin problems. Pain and edema can cause pain due to the pressure of the excess fluid on surrounding tissues and nerves. Stiffness, swelling can restrict movement, making it difficult to bend joints or perform everyday activities. Next is difficulty in walking. Edema in the legs and feet can make walking difficult or painful. And lastly, skin problems. The stretched skin over edematous areas can become itchy, dry, and prone to sores. Edema can be a serious condition with a variety of disadvantages. If not addressed, it can worsen over time and lead to serious complications like pulmonary edema, cerebral edema, and deep vein thrombosis, or DVT. Pulmonary edema can build up fluid in the lungs, can cause shortness of breath, chest pain, and even respiratory failure. Cerebral edema buildup fluid in the brain can lead to neurological problems, including confusion, seizures, coma, and even death. And deep vein thrombosis, DVT, can create blood clots in the legs that can form due to reduced blood flow caused by edema, which can lead to pulmonary embolism, a life-threatening condition where a blood clot travels to the lungs. It's important to note that edema can have serious consequences if left untreated. Therefore, if you experience edema, especially if it is sudden, severe, or accompanied by other symptoms like chest pain or difficulty breathing, seek medical attention immediately. Advantages. Edema is generally considered as a symptom of an underlying medical condition and is not typically viewed as having any advantages. It is important to understand that edema is a sign that something is wrong in the body and requires attention. Is edema beneficial? Edema itself isn't beneficial. Some of the responses to edema, like inflammation, can be helpful in certain situations. For example, inflammation is a natural response to injury or infection, bringing white blood cells to the area to fight off infection and promote healing. However, keep in mind that edema is typically a sign of a problem, and the underlying cause must be addressed. Edema can be uncomfortable, limit movement, and in some cases, can cause serious problems. Principles of edema. The understanding the underlying principles of edema formation is crucial for proper diagnosis and treatment. This response will delve into the key factors contributing to edema development, exploring the intricate interplay of hemodynamic forces, capillary permeability, lymphatic drainage, and renal regulation. We have here the key principles governing this processes: the Starling forces, general treatment, and other factors. Under Starling's forces, we have hydrostatic pressure, oncotic pressure, capillary permeability, and lymphatic drainage. And under the general treatment are addressing the underlying cause, the reduce of fluid retention, the improvement of lymphatic drainage, elevate affected limbs, and sodium restriction. And lastly, the other factors that may contribute to edema, which is gravity, sodium retention, and inflammation. Conclusion. In conclusion, edema is a treatable condition that requires attention and management to prevent complications. By taking proactive steps to reduce swelling and addressing underlying causes, individuals can improve their overall health and well-being. By understanding the meaning, mechanisms, causes, symptoms, treatment, principles, advantages, and disadvantages of edema, individuals can take steps to prevent and manage this condition. It is important to seek medical attention if symptoms persist or worsen over time, as early diagnosis and treatment can help prevent long-term damage and improve quality of life. However, with proper treatment and lifestyle changes, edema can be managed and swelling can be reduced. And that's it. I hope you learned something that can help you in your future professional endeavors. Thanks for watching.